It is a well-established fact that moderate physical activity gives us physical and emotional benefits. However, compared to older generations, we are spending increasingly more time in prolonged sitting. At work, at home, and in our cars, we spend most of our time in environments that limit movement and muscular activity. Additionally, the prevalence of sedentary behavior has increased because of so much time spent sitting during work. This video intends to address this by providing organizations with evidence-based information on the risks of this behavior and alternative methods to reduce sedentary behavior within the workplace. Many occupations require working more than 8 hours per day in a sitting position. More than 60% of American adults use a computer at their job, which results in the need to sit. A study conducted found that people who sit for prolonged periods of time are 2 times more likely to experience poorer perceived physical and mental health than people who engaged in physical activity within the past month. The systematic review of 20,980 studies found that prolonged sedentary behavior was independently associated with higher risk for all-cause mortality, cancer, and type 2 diabetes in adults. The study also revealed that cardiovascular disease, the leading cause of mortality in the United States, is also strongly associated with sedentary behavior. Prolonged sedentary behavior over many years can ultimately lead to frequent hospitalizations, decreased quality of life, and in extreme cases, fatality. At the same time, sitting impacts weight gain. Obesity is an escalating problem. It has similar adverse health effects as sedentary behavior, so the combination of obesity and prolonged sitting makes the issue even worse. Overall, it's critical for companies to address and mitigate the issue so they can prioritize their employees' health and promote better overall employee health quality. Employee health is a large area of concern for businesses and companies because employee health care is a major subset of a company's budget. In 2011, healthcare spending in the United States reached $2.9 trillion, with 78% of healthcare expenditures allocated to management of chronic disease. With health insurance and healthcare costs steadily increasing, controlling costs begins with helping employee health through prevention strategies. It is important and fortunately feasible to enhance the quality of life for employees at work because this is where people spend most of their awake hours. Employee quality of life may increase and may reduce their chance of facing the risk factors associated with too much sitting over time if alternative workplace stations are implemented. There are many evidence-based workplace strategies for all types of businesses to reduce sitting and subsequent poor health outcomes among employees. Moving more, sitting less, and standing during phone calls and meetings are widely accepted and simple practices to increase physical activity. Rearranging the work environment to include active furniture and alternative workstations facilitates a work environment that mindlessly allows employees to work while engaging in more physical activity. Interventions include treadmill desks, pedal equipment such as a bike desk, and most importantly, sit-stand desks. Standing desks have increased in popularity because there are many types available for all office environments and at every price point, from a few dollars to make it a do-it-yourself desk to a couple $1,000s for an electric-powered adjustable height desk. Alternative workplaces can be highly effective if combined with one-on-one healthful behavior coaching. The lunch break is another easy opportunity to increase physical activity. Example activities include taking a walk or providing a group fitness class. Employees will return to work refreshed and better focused for their job. Consistent motivational messages such as these by the Centers for Disease Control and Prevention's Healthier Worksite Initiative. Studies suggest barriers of concern come from the management level of businesses. Concerns include worker productivity, feasibility, awkwardness of standing, and the norm of sitting. However, the best manner to approach this is to address the concerns based on the workplace environment and employees. Evaluate your workplace environment to determine feasible strategies. Then, simply ask your employees what they would like, along with providing them with possible implementations. Consult occupational health professionals to determine which interventions or strategies are most appropriate and feasible for your work environment. To get started, visit the National Institute for Occupational Safety and Health website to receive useful, free tools to create policies and practices that promote employee health.